Share in this video are simply things that helped me get through this recovery better, and I wish I had known before surgery. So let's begin. After almost a year, my pain, many appointments, many therapy, many testing, I wanted to share everything I have learned and tips that I wish someone had told me before or warned me about before surgery. If you are considering surgery or currently recovering, I hope this video helps make your life and your journey a little easier, a little better. Part 1, before surgery. Lesson number 1, a normal EMG doesn't always mean nothing is wrong. One thing I learned is that nerve conduction studies or the nerve tests and EMGs can sometimes appear normal, even when your symptoms are very real and very consistent. In my case, my physical examination showed positive signs, even though some of the nerve tests wasn't dramatic. If your symptoms continue and affect your daily life, don't automatically assume you are imagining things and put the blame on yourself. Listen to your body and keep advocating for yourself. Lesson number 2, give occupational therapy a chance. Occupational therapy helped me a lot. It improved my flexibility, my movement, and symptoms. I wish I had done occupational therapy at the very beginning, because I did it later on in my journey. Occupational therapy does not solve my problem. If you have been consistent with therapy for months and symptoms continue to affect your life, then surgery may become a conversation worth having with your doctor. Lesson number 3, find the right doctor and the right surgeon. This is extremely important. There are many excellent surgeons out there. If you feel unheard, rushed, or your concerns aren't being addressed or getting a second, you can find a completely second opinion on someone else. Having a new doctor can effectively change your journey. Don't give up just because one doctor doesn't have an answer for you. Lesson number 4, ask detailed questions before surgery. Some questions I recommend asking include, what exactly will be done during surgery? What are they going to do? How is going to help them? How painful is the recovery? How long before I can drive? How long before I can return to work? And if I can return to work, will it be a part-time first, light duty, or full-time? Do I need occupational therapy after? What restriction will I have? How long before I can exercise, or what weight, how much weight I can lift? The more information you have beforehand, the less stressful recovery becomes. Part 2, preparing for surgery. Food preparation, prepare meals before surgery, and that can be anything. You may have just the frozen food you can easily heat up, or you can prepare your meal for the week and you put it in a container that you can just put it in microwave. Easy microwave meals, pre-cut fruits and veggie, easy reachable snacks, paper plates, disposable utensil. Trust me, washing dishes with one arm is not an easy task and is not fun. Clothing tips. Nobody told me about this and I figured this out in my life. This was one of the most helpful things I have learned during my journey. Wear very loose fitting clothes that zips or buttons in the front like this. Oversized shirts are much easier than tight fitting clothes. Honestly, I have spent a lot of time wearing my husband clothes. If you have, your brother, your husband, or whoever got bigger clothes, wear their clothes first. When you're getting dressed, put your surgical arm into the shirt first. When you're taking the shirt off, remove your non-surgical arm first and let the surgical arm come out last. This puts less strain on the healing arm and makes dressing much, much easier and faster. Then, for girly girl like me, if you have long hair, I don't know who can do it. I cannot tie my hair with one arm. This hair clipper will save your life. Get the hair clip. Or one hair clip can be impossible too. What I do, I lean to wherever, the wall, whatever. Try to use one of my hair. It has the wall, hold it up. Use this to clip on. If you cannot do that, get this hairband so at least the hair is not on your face. Then, next thing, stock up on essentials. And I mean essential about anything in life. Make sure you have toilet papers, tissue paper, medication you will need anyway for whatever condition you have, pet supplies, water, easy snacks you can reach and open, prescriptions that are already filled. Have someone in your home, if you do drink water from bottled water, ask them to help you open the cap every morning, like 5 of them every morning, or put the water in a big Yeti cup so at least you can sip all day with one hand and don't have to like struggle opening anything. Trust me, the last thing you will want to do after surgery is run errands and try to get things that you need, or want to cry, cannot open a bottle of water. Medications, talk with both your surgeon and primary care doctor. Ask, which medication should I stop? How long should I stop? When can I restart them? Are there any supplements like vitamins that increasing my bleeding risk? Some like fish oil, green tea. This is especially important if you're taking blood thinners, diabetes medication, or even weight loss prescription. Make sure you ask this on both sides, your surgeon and your physician. Schedule your life around recovery. Try to reschedule unnecessary appointments. If you do need dental appointment, ask your doctor, when should you do it? Before surgery of how many weeks, or after surgery of how many weeks? Hair appointments or nail appointment, these are one thing. Some surgery places will tell you to remove your hair, not your hair, your nail polish. If you just get your beautiful, gorgeous one, you have to remove it, that would be a bum. So maybe have a nail appointment 2-3 weeks after when you're already better. Other type of appointments with your family. That could be from hanging out with your family, vacations, social events. Tell your families and friends, I need this much recovery time, I will not see you because I can't. Try not to do everything at once. Part 3, the day of surgery. What helped me most is don't make major decision after surgery between anesthesia and pain medication. You may feel groggy, tired, and nauseated. Give yourself permission to rest, fully rest. Recovery starts immediately. Nausea can happen because your those anesthesia drugs that you get from the doctor or some pain medication you received can cause you to feel very nauseated. The doctor tend to prescribe anti-nauseous beforehand. So before your surgery date, make sure you got that medication they prescribed you. When you start to feel nauseous, take the anti-nauseous medication immediately. I had that experience, I take it immediately and I'm glad I did. Part 4, recovery tips and products that helped me through it. Pumping bottles. I don't have it around here. These kind, I'm telling you, it's hard using your non-dominant hand to open. Any bottle that needs you to screw it or the squeezing, the pumping, that can be from lotion, shampoo, hair conditioner, face wash. It's the easiest to use. This kind of bandage, I recommend you get. It's a little bigger, so for wound care, when it's bigger, you don't have to worry about the glue got close to your wound site. When the doctors told you what to do, always follow your surgeon's instruction. Let's say they said after 3 days you can remove and shower. You do that. You change the dressing. They said to use the non-stick bandage to on it. Try to avoid placing adhesive directly over the incision. This comes from my experience, okay? There's one time that the glue kind of stuck at one end and it peeled off my skin now. It hurts and then like some fluid leaking. I do not like that. Do not panic if your incision looks swollen, bruised, or like unattractive at first. That's very common. After a week, like healing takes time and it looks better after. Shower protection. Now to shower, if you're worried about getting the incision wet when it's not fully healed yet, consider using a waterproof cover during shower. It gives me such peace of mind. You can buy these online on Amazon, or the nurse recommend me to get what is it called? The umbrella cover that you find in like at the grocery store. You put around your hand as like a sheet version, then you use towels to wrap it up. That works too when you wash your hair so it doesn't get into your wound, doesn't get soaked. Again, they said after 3 days you can shower, but maybe don't get it fully soaked in like bath or pool or beach yet, because they are afraid of infection. Sleeping tips for me. Be mindful while you're sleeping. Your stitches can catch on blankets, clothing, sheets. Once it catch on fabric, it will pull your wound and it hurts. However, try to let your wound breathe during the day. Try not to always covering it up, because covering it up might not be good for your wound. It will get wet, it might get infected and more inflamed. So let it breathe, but be careful when you move. Part 5, Occupational Therapy and Rebuilding Strength. After the surgery, occupational therapy become very, very important. My arm felt weak first. I couldn't lift up things or open the bottle. My muscle tired very quickly, and that can be completely normal because first, the arm hasn't been used much for a long period of time, and the nerve is still recovering. So your muscle needs time to rebuild. Think of it like returning back to the gym after months of inactivity. So it will get sore at first. Progress takes patience and takes a lot of time. Part 6. Do not forget the neck, shoulder, and the posture. One of the biggest lessons I learned is that not every symptoms come directly from the elbow. Neck issues, shoulder tension, poor posture, muscle knots, muscle tightness, all of these can contribute to nerve irritation. Even after surgery, stretching, posture correction, and taking care the entire upper body remain important for me and for everybody. Part 7, was surgery worth it? Now, for these questions that everyone asks, and you might ask me the same thing. For me, yes, absolutely. I have been suffering for this for a year now. Am I 100% recovered? No, I am not. But think about this. How long does your body take to actually acquire this syndrome? It takes years. So for me, if it takes years to contribute to this syndrome or symptoms, it will take more than 2 weeks, 3 weeks, 3 months to recover. It will take time to get me back my strength. However, if you ask me, does this is absolutely better than before I have a surgery? 100%. Before I have surgery, I am literally living with tingling pain from wake up to go to sleep. After I struggling with that and done all the things that they told me to do in steps, this has improved my quality of life. I can actually think of plans ahead in the future. Oh, I may be able to go back to work now. Maybe I start slow first. Now I know how to take care of myself. During the video, I'm gonna still roll my shoulder. So 100%, if you already tried out all the sources possible, from going to physical therapy, checking your massage, get your massage therapy, some try dry needling, acupuncture, and you try that for months, you give your time to try and it doesn't work, maybe surgery might be the way for you to go. Final message. If you are currently dealing with cubital tunnel syndrome, I know how frustrating it can be. You have probably tried braces, exercise therapy, medications, and countless appointments. Just know that you are not alone. That's why we are here with you. I'll be posting more videos showing my real, actual recovery times from the surgery day, incision healing, my therapy journey, and progress updates. If this video helped you, please like, please subscribe, and leave your comments or your questions below. I would really appreciate that. I would love to hear about your experience and your recovery as well, or even your tips of getting better. I wish all of you the best in your recovery journey. Thank you so much for listening. I hope you have a great day.